Today on Cityline, the lasting legacy of Dr. Martin Luther King Jr., the leaders continuing his work decades later here in Massachusetts. Hello, everyone, and thank you so much for joining us. I'm Jessica Brown. Dr. Martin Luther King Jr. considered Boston his second home. It's where he met his wife, Coretta Scott King, and where he earned his PhD in theology from Boston University. Today, the Embrace sculpture pays tribute to the couple's enduring love on Boston Common. And as we look ahead to the day that honors the civil rights leader, we're reflecting on how the work for the causes he championed continues. Now, Dr. King once said this: of all the forms of inequality, injustice in health is the most shocking and the most inhuman. In 1965, doctors and concerned citizens recognized the need for affordable primary care in underserved communities, and that's when community health centers were born. The centers were funded as part of President Johnson's War on Poverty. And joining us today is Michael Curry, President and CEO of the Massachusetts League of Community Health Centers. Thank you so much for being with us.
Very glad to be here.
It's an important topic. We have to talk about what's happening here because we want to talk about the history first.
Okay.
Let's talk about how Massachusetts played a key role in community health centers.
So it's interesting when folks were in the 1960s really trying to integrate lunch counters, desegregate schools. Hospitals were segregated through the 1960s. So when Dr. King provided that quote that you said, of all the forms of inequality, injustice in health, not health care, because health is broader, is inhuman, not inhumane, which is often the quote people know. He said that in 1966 outside the Medical Committee for Human Rights in Chicago in 1966. Many of the folks in that room that day in that conference were Bostonians. They were activist physicians in Massachusetts who wanted to deal with the segregation in the nation's hospital system. So he had a deep connection here beyond the fact he went to school here, he met his wife here. He also connected with the healthcare community here. And our movement was born in 1965 in December, with the very first health center in the country being in Columbia Point in Dorchester. So I like to believe not only did he set his roots here when he was in school, he inspired a movement in healthcare here as well.
Absolutely. 60 years, right? Community health centers have now existed. Let's talk about how it's evolved over that time.
So when you think that first health center in 1965 December, there are now over 32.5 million people getting their care at a community health center. Over 1,600 practice sites across the country, or 1,600 health centers. In Massachusetts, we serve 1 out of 7 people in the Commonwealth get their care. 98% of the zip codes, people are being served by a community health center. So credit to 60 years, but we knew there was a need. We knew that people in rural communities needed access to care. We knew that black and brown folks, that poor people, that immigrants needed to get the care in the right place at the right time at the right cost. That is what 60 years has brought us. So we have a movement now that is serving a majority of the Medicaid population across the country, that is serving immigrant communities, that is serving poor and marginalized people. And quite frankly, now we recognize also solving for the social determinants of health, the poverty, the food insecurity, the environmental issues that are making people sick. It's an honor and a privilege to be a part of that movement.
Yeah, well, we had, this past week, the Trump administration cut thousands of substance abuse, mental health grants, and then abruptly kind of reversed course here. How does that impact community health centers? It's
destabilizing, right? We know that when the Trump administration came in, and of course the actions under the OB3, the one big bill, impacts Medicaid and will cut many people off of Medicaid and cut funding to Massachusetts. We know that not extending the tax credits destabilizes people who need the subsidies to get their health insurance. And then now you got grants that are being cut. And when a grant is cut, just to show the magnitude of that, $2 billion that were going out into communities across the country to provide substance abuse services to those most in need that are suffering from addiction, recovery coaches who are dispatching into communities to help people with that addiction, and mental health service and homelessness. And then you're told today, as of today, that grant is eliminated. So those full-time employees you have, those services you're providing, those clients you're providing care to, stop. Of course, it doesn't work like that, right? People have jobs and services are being provided. We were fortunate in this case, there was enough pushback from both sides of the aisle to get them to change that decision. But I'm foreshadowing that we know this administration, more is to come. Yeah. There'll be more grants that are maybe targeted LGBT communities or DEI programs or gender affirming care or immigrant services. I am deeply concerned that this is not the first and only example of cutting services and really destabilizing health center care across the Commonwealth.
It's a concern for a lot of people, we know, right? Medicaid cuts, that was a big controversial part of the so-called big, beautiful bill you just mentioned, right? How do you brace for the impact of all of this?
Yeah, I mean, it's interesting. It's been dominated my last several months is really coming up with contingency plans, right? If you run an organization, and in our case, 31% of our revenue on average at a health center is Medicaid dollars. 47% of our patients are Medicaid recipients. 80% of our patients overall are in some form of public subsidy, Medicaid, Medicare, on the connector, as we call it, in Massachusetts. When you know that there's disruption and cuts, that means that their finance, the financial infrastructure of a health center, we could lose health centers, right? When you think we serve 1 in 7 in the state and 1 in 2 in Boston, imagine if your health center closes in Roxbury, Lynn, Lowell, Lawrence. That is a reality. So we've had to come up with contingency plans. What services will we cut? How do we reapply for those grants and maybe change the words? Hopefully not change the programs and the services. This is a disturbing time, and I think it's ironic 60 years later after the launch of the health center movement, born out of civil rights, that we're now at this other civil rights inflection point. How do we defend what we know is right? And I think that's where the movement is we are now making sure we stand up for those LGBTQ, Black and brown, poor, rural folks that gave birth to this movement.
Yeah, you know, you mentioned the 60 years because for decades, community health centers have really had to overcome obstacles from the beginning. Now, continuing to do so, how are you continuing to do so to help neighbors in need? And what do you think Dr. King would think of the centers that are here today?
You know, I think it's funny, you give me chills when you ask me that question. I think he'd be very proud. I think he'd be proud because he knew that his focus was on really other key parts of civil rights during that time. But he had created a movement of activist physicians like Dr. Robert Smith, who people don't know, he's in his 90s in Mississippi, and he still provides care. He was the doctor to Dr. King. He provided care to Dr. King when he was in Mississippi and protesting. Jack Geiger and Count Gibson are architects of this movement, or Elsie Dorsey, names that people don't know but they should know, were risking their lives to create this movement. I think Dr. King would look back at what we've achieved and say, job well done. This is what we were talking about. The reality is, and people often quote it, the life expectancy difference between Roxbury and Back Bay is not new. In rural Mississippi and in Columbia Point, people were living sicker lives, high morbidity and high mortality, high maternal death then and now. He would say, job well done to create institutions that are on the front lines of addressing those issues and solving for what happens upstream that's making them sick. So I think Dr. King would be very proud, and he'd say that quote that you shared. We're living that quote to address those inequalities that are, quite frankly, inhuman, what happens in our healthcare system.
Yeah. Michael Curry, thank you so much for being with us and sharing your insight on this important issue. Thank you.
Blessing and an honor to be here. Thank you.
All right. Coming up, when we return, fighting for a better future on Beacon Hill, how one state lawmaker is turning Dr. King's legacy into legislation.